Okay. No, the x-rays, they're not bad. Unfortunately though, you do have a little bit of a gum infection, so we're gonna have to take care of that as well. Okay. Yeah. No, it's fortunately you were able to come to me like in time, so it's very small, but it is something that does need to be addressed. Okay. Yeah. So I know that you did sign up for just like a routine cleaning, correct? Okay. So we're gonna go ahead and do that first because we do, even though you are a previous patient, so we have your x-rays, we still like to start with just like a preliminary, just like dental cleaning before we do any like any work besides that. Does that make sense? Okay. So I'm gonna start with this dental pick. I'm sure you've seen one of these before, yeah. This one I really like because it sort of like vibrates a little. That way, like any plaque you have is just gonna like fall right off. Yeah. Yeah, it's actually very satisfying. So, we're just gonna do that for a little bit, and then I'm gonna follow up with brushing your teeth. This is just a standard ADA toothbrush. It does the job. I know it's not too fancy. I know some dentists use like the Philips Sonicare, but honestly, like if you do it right, it's just as good. That's my opinion. And I also have this toothpaste here. Okay. This is going to be a Crest brand, as you can see. And this is going to be cavity protection. Oops, dropped it. And it does have active fluoride, which is going to be really good because we want to make sure that like the fluoride is acting and that everything is being taken care of. Okay. So if you like, I can also give you a small sample. We have like little mini samples that we give to all of our patients. Do you want one? Okay, perfect. So I'll go ahead and I will do that for you as well. Okay. And then what we're gonna do is after we do like the surface cleaning, like everything on like the surface of your mouth, I have this like water pick, and this is going to be doing some like root planing. Have you heard of that before? No. Okay. Well, all that means is we're going to go ahead and we're going to just be like working like beneath the surface of your gums. Yeah. Because there's like, you know, what you can see like above your gum line. Yeah, and then there's also like this area below. Yeah, and what this is going to do is it's really just going to like deep clean like anything like below the gum line. Yeah. No, this is it's really effective. No. It honestly, it doesn't hurt at all, but I am going to go ahead and I do have like this numbing gel that I will put like on your gums just to make sure that it doesn't like hurt. Okay. Yeah, no, but just let me know if it does, like for whatever reason, and we'll just stop and we'll just like relax and then we'll like start again. Okay. Yeah, no, I don't want you to feel like any kind of pain or anything like that. Okay. So, I know I did see on your chart, as I mentioned, you do have like a small gum infection. Yeah, but fortunately, we were able to see it on the x-rays and it's in its like early stages. So, we should just be able to take care of it today. Okay. Okay. So what I want you to do first is I want you to just lean back in your chair. Okay. Yeah. There you go. Perfect. Okay. Is that comfortable? It doesn't feel okay. Feels okay? Good. All right. So let me just scrape away. You do have like a tiny bit of plaque, which is normal. No, even if you brush your teeth, that can sometimes show up. So, yeah, that's completely normal. No, that's what I'm here for. Just take care of it. Yeah, it's okay. Just relax. There you go. Very good. Now you don't feel like any pain, right? Okay. No, I know. It happens to everyone. Yeah, it's just a matter of just like making sure that, like, 6 months just to like make sure everything's clean. Yeah. Okay. So I did notice some parts on your teeth that are a little like yeah, it looks like it's been there a little longer, so it's turned into tartar. So unfortunately, just this alone isn't going to be the trick, do the trick. But we do have some like other tools here, so I'm going to do like a little bit of scraping just to make sure that like we get that tartar off. Okay. All right, so just relax. No, there's no need to be nervous. I know, honestly, like I get the same way, but everything's gonna be fine. Okay. Yeah. I know it sounds a little intense, but it shouldn't hurt. You doing okay? There's just like a little bit more like in the very back. Yeah, and I understand because it's really hard with just like a toothbrush to like really get back there. You know what? I just realized I should probably be wearing a mask. So this is an N95, which is gonna be like a really really good barrier, like protecting from like germs and like all of that kind of stuff. So yeah, I just want to make sure that you feel just like safe, that it's like a hygienic environment. Okay. I know. I kind of like that sound too. Okay, so just gonna go ahead and put this on. Okay. Yeah. Okay. That's better. So just gonna do a little bit more scraping, just get that last bit of tartar off, And then I'm just gonna go over with just like the toothbrush and the toothpaste, okay? All right. Yeah, you're doing so good. Well, congratulations, you're getting married. That's wonderful. Okay. I know, I feel like I've missed a lot. What has it been, like 8 months since I've seen you? Yeah, a lot can happen in 8 months. Okay. Oh, yeah, there, unfortunately, there's quite a buildup, like in the very, like, back of your mouth, but that's okay. I got it. There we go. Perfect. There we go. Yeah, I mean, it's probably because it's been so long since you've seen me that, like, a lot of that plaque has turned to tartar. Yeah, it just happens. It just happens, like, if you don't get it right away, it just, like, over time, sort of, yeah. You know how it is, but that's okay. Because I have all the tools that, you need. Okay. I think we got it. So now I'm just going to go ahead. I have this toothbrush. Yeah. So I'm just going to go ahead. I'm just going to brush your teeth. And honestly, this should just be like really relaxing. And go ahead and put the toothpaste on it. Yeah. I know. I know. It's okay. Like, we can take care of that gum infection. I know every other time you came in here, you've had like just like perfect mouth, but these things happen. It's okay. We're gonna take care of it. Okay. Okay. There's a little bit of toothpaste. Okay. So I want you to just like open your mouth like a little bit on my fingers, like as wide as you can, okay? Okay, perfect. There we go. Oh, you're doing so good. I know. No, we're gonna take care of it. We're gonna just put like some numbing gel, and then we're gonna go ahead and we're gonna just like clean like beneath the surface and make sure like everything's clean. And then I do have this topical ointment, which is like also like an antibacterial. Yeah, it's gonna be like an antibiotic of sorts, and it's just gonna make sure that like we kill like whatever bacteria is in there. Okay. Yeah. I know, I get stressed too. There's just something going wrong. It's just hard to relax. I totally understand. That's why I'm here, okay? All right, you're doing so good. Yeah. Oh, sorry about that. I think I hit the chair a little bit. It's okay. Yeah, you okay? You're doing amazing. Yeah. So besides getting married, what have you been up to? Making music? Amazing. Oh, you got signed on a record? Congratulations. Okay. I know, I missed so much. I know. Yeah, you have to come visit me more often, even if like you don't need any dental work. Like I'm still here, you know. Yeah. Okay. So now that your mouth is clean, what I want to do is I want to go ahead, and I do have that that numbing gel that I was talking about. Okay. So this is just gonna make sure that like you literally just like don't feel anything. It's just like numb, and you can just like relax, and like you shouldn't, honestly, you shouldn't feel anything. But do let me know. Like sometimes it's not like 100% effective. Okay, but yeah, just let me know. All right, so open your mouth. Just gonna go ahead and I'm just gonna put it like right above the teeth, like right on the gum line. Okay, there we go. Perfect. There. Okay. Okay. A little bit more. Okay. So I'm also going to use, I have these cotton swabs. I think it would actually work a little bit better. All right, no, keep your mouth open. I know sometimes it's a little hard to like keep it open wide, but we got to do this just to make sure that we get that infection. Okay. Okay. There we go. Yeah, it's okay. Okay. All right. No, you're doing amazing. You really are. Okay. Now, do you feel anything? Just a little cold? No, that's perfect. It's going to be like a little bit cold at first, but then you'll be fine. Okay. Okay. So, this is going to be, I know it looks a little scary, but it's really just like a really high pressured like water pick. So it's going to just like get really like beneath the gum line and just like get out like any kind of like bacteria or anything that basically like just doesn't belong there. Okay. Okay. There we go. All right. You feel okay? You don't feel like any pain, nothing like that? Okay, good. Perfect. All right. Almost done. I want to get really like underneath that third quadrant here because that's kind of like where most of the infection is coming from. It's okay. Actually, yeah, you should actually start to feel like just like a little bit lighter too. Just getting all that like tartar out like beneath the gum line. Yeah. All right. Now it looks so much better. Yeah. So a little bit more. Go ahead and just like do like the very back of like your left quadrant. All right. Very good. No, honestly, it looks so much better already. just like looking at your mouth, it looks like an entirely like different, like, yeah, looks so much cleaner. I think you're gonna like really notice a difference like when you go home. Okay. All right. Just a little bit more. I think I missed a little bit back there. Yeah. Okay. That looks really, really good. Okay. So, I do also have this ointment that I'm going to apply because it's like a topical ointment. I know we got like below the gums, but this is like on top of the gums, just to like make sure that like it like just like kills like any bad bacteria. Yeah. Yeah, what I want you to do is in a week, if it hasn't cleared up, just give me a call. We'll do the treatment again. But usually within like 2 days, it should be like completely clear, okay? Yeah. I know. It's no fun. It's no fun having like any kind of like dental problems or really just problems in general. So, yeah, I know. But luckily this is fixable. It's just like a little bit of like just a little bit of a topical ointment that should like solve everything. Okay. It's fairly common. It happens, yeah. It's not from like a lack of brushing. It really isn't. It's just like sometimes just like bacteria just gets in there somehow, you know. Honestly, I don't even know how these things work sometimes, but it's okay because it's treatable. Okay. So I'm gonna go ahead and I'm just gonna put this like on top of your gums just to like make sure it's like numbing as well as healing. It's gonna take away like any like infection. Okay. Yeah. Yeah, I'm gonna go ahead and I'm gonna use this toothpick again. That way I can make sure, not a toothpick, it's a cotton swab, a Q-tip. So I'm gonna go ahead and I'm gonna use this little swab here, and I'm just gonna go ahead and just like get like every single area of your gums, okay? Especially like the area like right here, because that's kind of where like the center of the infection is. Yeah, and it just kind of like goes outward, but still want to make sure we get like everything, just to make sure that we get this taken care of. Okay. Okay. So open your mouth. Here, let me just push your mouth open a little bit. Yeah. Do you feel what I mean? You want to feel like a stretch, like you're actually opening your mouth. Yeah. Perfect. Okay. Very good. Yeah, you're doing so good. Okay. All right. You still feel numb, like it doesn't hurt at all, right? Okay. Good, 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 good. All right. Oh, you're doing amazing. Mm-hmm. Okay, perfect. All right. Okay, so I'm gonna go ahead and I'm gonna set your appointment from 3 months from now, okay? But if it doesn't clear up in a couple days, just like give me a call, and yeah, we'll go ahead and we'll like meet you like earlier, obviously, and we'll just keep going with the treatment. And honestly, I think you're gonna be fine, but there is like, I think it's like a 2% yeah, chance that maybe it won't take the first time. Okay, but don't worry, I think it'll be fine. So I'm gonna pencil you in because unfortunately our computer system is completely down, and I'm just gonna go ahead later and just like put it in like the data entry. Okay, so okay, so I'm gonna put you at 3:30 in 3 months. Does that work? Okay, perfect. So 3 months, and just give me a call if anything changes. I know my schedule sometimes changes without notice, and you never know, and that's okay. But just give me like around like 24 hours notice is usually, yeah, if you can. We'd appreciate it, because like honestly we've been so busy like this season, so yeah, just let us know and we'll just like get you rescheduled. Yeah. Okay. You feel okay? It's just numb. Okay. Yeah, it's probably gonna last like an hour, and then you should start to feel like sensation. No, just give me a call if that doesn't happen, but usually it just takes like an hour or so to wear off, and then you can go ahead and you eat whatever you want. Don't worry about it. Yeah, but just make sure that, like, you know, if for whatever reason you're still numb after like say 6 hours, give me a call and we'll figure it out, because that's what we do here. Okay. Okay, well, thank you so much, and